మీరు కనుక ఫస్ట్ టైం మా ఛానల్ చూస్తున్నట్లయితే లైక్ చేయండి, షేర్ చేయండి, కామెంట్ చేయండి. ప్లీజ్ సబ్స్క్రైబ్. మేము అందించే లేటెస్ట్ వీడియోల నోటిఫికేషన్ కోసం పక్కనే ఉన్న బెల్ బటన్ని ప్రెస్ చేయండి.
Hello friends, I am Dr.shakuntala Ghosh, Senior ENT Consultant and Director of Sri Rama ENT Care, Hyderabad. Today I am going to speak to you about a very pertinent topic, that is headache. So the headache is a very common symptom and a very common disorder found in our population. About 75% of normal human beings also experience at least one episode of headache in a year. So the causes of headache could be very benign or could be also very serious. So what could be the common causes of headache which we encounter as a practitioner? Headaches are basically of two types. One is primary headache and the other is secondary headache. So what is primary headache? Primary headache includes few entities for which are tension headache, cluster headache, migraine and sudden daily headache. So the causes of these headaches are basically due to dilatation of the blood vessels which are present in the temporal region, and the triggers could be a few. For example, intake of certain food items like chocolate, cheese, excess caffeine or alcohol or smoking. Also emotional stress, lack of sleep, and exposure to too much of sunshine, long journeys, disturbances in their sleep pattern. So these are the common triggers of these migraine headaches or clusters. So then the second cause of headache, that is secondary headache, where there is a specific cause for headache. So here there are certain general causes, for example, hypertension which is uncontrolled, or accelerated hypertension where the blood pressure suddenly shoots up to 200 millimeters systolic or above, which can lead to a sudden onset of headache in a normal patient. The other causes could be certain psychological factors like emotional stress or tension at work, or due to disturbed sleep or disturbed food habits like taking your meals late and not having adequate hours of sleep and worrying too much, or emotional stress. Then there could be anxiety, long-term depression or mood swings, premenstrual syndrome. So here also hormonal changes can trigger mood swings, changes emotional disturbances and headache. So these could be the few psychological causes of headache. Other than that, there could be the stress can itself lead to, there can be some local causes of headache. For example, impacted wisdom tooth. So usually it can happen at the upper or the lower jaw, temporoparietal region headache radiating to the ears and one side of the face or the head. So that could be due to impacted teeth. Then temporomandibular joint arthralgia. So where there is inflammation of either one or both the temporomandibular joints, the patient can complain of pain while opening the mouth or chewing, and that pain can radiate again to the temporal region, to the ear, at the back of the head and to the neck. Then there can be other causes, for example, cervical spondylosis itself. So in that case, the headache can be accompanied by giddiness also. And at the same time, there can be pain radiating to the neck and the shoulder with tingling, numbness of the palms and weakness of the side on which the spondylosis is affecting, compressing the nerves. Then the other causes for headache could be intracranial causes, which are more sinister. So here we have a group of causes. For example, there can be some vascular loops, or there can be some blood clot in the blood vessels, in the arteries which are supplying blood vessels which are supplying the brain, which can lead to infarction and a cerebrovascular accident. Or there may be minor transient ischemic attacks but associated with headache. And then there can be cerebral venous thrombosis, that is the veins which supply the brain, can get blocked and there will be clotting of those veins, that is venous thrombosis, and that can lead to severe headache. Then there can be other causes like head injury, which can lead to hemorrhage or blood clot, which can be subdural or extradural, and that itself can cause headache. Then raised intracranial pressure. This could be either benign intracranial hypertension where the cause is idiopathic, or it could be due to some tumor which is causing the blockade of the CSF flow, leading to raised intracranial pressure and headache. Then intracranial tumors, benign or malignant, that can also cause headache. Then there are certain infective conditions like meningitis or encephalitis which can cause headache. So in meningitis, usually there will be high fever, there will be neck rigidity, and there can also be projectile vomiting with altered sensorium, and these are the symptoms which lead us to the diagnosis of meningitis. So similarly, encephalitis, which is also viral encephalitis most commonly, that can also lead to headache. So these are the common causes of headache which I have enlisted to you. Now, so once we have told you about the causes, now basically how does the patient present to us with headache? So normally a patient will come with the symptom of headache either to the ophthalmologist or to the ENT specialist or to the neurologist. So ophthalmologists will of course rule out the two common causes of headache, which can be either refractory error or glaucoma. So a detailed examination of the fundus and the refractory error can be ruled out. So then next is the ENT cause. So ENT cause could be, like I mentioned, that sinusitis or rarely some otological infection. Infection in the external or middle ear can also lead to headache. So basically we ask for history of any facial tendon pain or pain in the upper teeth, any frontal headache. Is the headache worsening when the patient is bending the head forward? Are there accompanying symptoms like nose blockade, discharge, thick discharge from the nose, or kind of like cold, runny nose, or any postnasal drip, any cough, fever? So these will lead us to the symptoms of sinusitis, and we can exclude those by examination and radiology. Next is we examine the ear as an ENT specialist to rule out any cause in the ear, for example otitis media or ASOM, where there is pus discharge or any bulging or congestion of the eardrum, any tenderness around the ear, mastoid tenderness, or any pain in the on touching the pinna or bulging of the pinna outwards. Then also we look for other symptoms like giddiness, etc., which can also lead us to some diagnosis of any otological cause for a headache. Then next is we examine the temporomandibular joint to find out if there is any tenderness while the patient is opening the mouth or chewing or gritting his teeth. Then we examine the teeth to look for any impacted wisdom teeth. Then also we examine the neck to see whether there is any tenderness of the neck muscles, either on the sternomastoid, the trapezius, or the nape of the neck muscles, because cervical spondylitis will present with extreme tenderness of the neck muscles and neck stiffness, inability to move the neck properly either to one side or both the sides. So these are the local causes of headache, so which we can rule out by an examination. Next is of course neurologist will of course examine the other causes of headache. He will do a detailed neurological examination, higher neural functions, the cranial nerves, the cerebellar functions, the gait, etc. And then he, if there is any suspicion of any intracranial cause, that is especially if the patient has associated symptoms of headache, for example if there is any giddiness, imbalance, and then if there is any vomiting, projectile vomiting, then if the headache is very severe in onset and sudden in onset in a previously healthy patient, or if there are associated symptoms like blurring of vision or altered speech, any altered behavior, altered sensorium, that is either the patient becomes drowsy or incoherent or is not able to comprehend or obey commands, or the patient becomes very restless. In case of any of these alterations in the sensorium, or if there is any weakness of the limbs, etc., or any facial paralysis, so these will warn us about any sudden stroke, cerebrovascular accident, etc., which can be ruled out by radiology, a CT scan of the brain or MRI of the brain. Other causes like intracranial tumors can also be ruled out. Then by MRI venogram can also rule out any cerebral thrombosis, intracranial thrombosis. Then examination of the fundus can also rule out conditions like benign intracranial hypertension. Of course, if we think of meningitis, then a CSF analysis after a lumbar tap can also rule out any infection in the meninges. So we have kind of covered most of the grounds, and now we know the diagnosis. So clinically, migraine has a very typical history, and the investigations will all be normal. So the presentation will be very classical. So based on that, the neurologist usually prescribes medications for migraine, which is preventive, that is prophylactic, and also for the acute symptoms. If the causes are other causes, like for example sinusitis, then we give them a course of antibiotics, antihistamines, steam inhalation, topical nasal decongestants, and usually within 1 to 2 weeks the acute sinusitis will subside and the patient will get relief from headache. If the cause is of course refractory error, then the ophthalmologist will prescribe the glasses which the patient has to wear, especially when reading or looking at the blackboard, or if needed, for whatever, as and when prescribed by the ophthalmologist. The other causes, if it is cervical spondylitis, then we advise certain isometric neck exercises, ask the patient to have a good posture and not stoop while they are reading or looking at their laptop or desktop. Ask them to keep the screen, the computer screen, at eye level, that is preferably using a desk and not sitting on the bed and looking at the computer screen. And also to do some gentle neck exercises to ease the muscles, prevent prolonged hours at the desk, at the laptop, or using the computer screen. Then some general advice is also given, for example, relaxation exercises, relaxation breathing exercises, then how to manage their stress. These are also very important. We ask the patients to have a healthy, nutritious diet, take long walks, and have adequate hours of sleep, about 6 to 7 hours of sleep per day, to take their meals on time. And if it is migraine, then certain triggers like coffee, chocolates, then any caffeinated drinks, cheese or other dairy products, then certain citrus food items are to be avoided. And also they should also avoid exposure to bright sunlight, and also take adequate rest and breathing exercises. So these can help to prevent frequent attacks of migraine. So friends, I have given you an overview about what could be the causes for the headache, and a checklist of how to examine and take a detailed history and rule out the causes of headache and narrow our diagnosis, and then what are the investigations we will order to support our diagnosis, and how to treat the causes, treat headache depending on what cause it could be. So I hope this video is useful to the common public and to you as a clinician in address the symptom of headache. Thank you.